Hello viewers, this is Dr. Sam signing in today's Doctor's Voice. Viewers, today we'll get to know about some gastrointestinal issues and liver related issues with two distinguished consultants from Mount Elizabeth Hospital, Singapore. On my right side, I have Dr. Chan Chung Yip. He is a general surgeon with special interest on hepatobiliary surgery and liver transplant surgery. He is currently working at Mount Elizabeth Hospital, Singapore. Hello, Doctor. Welcome to our show.
Hi, thank you for having me. Thank you.
Yeah, it's a pleasure. And on my left side, I have Dr. Phu Kian Fong. He is a medical oncologist, currently working at Mount Elizabeth Hospital, Singapore and Gleneagles Hospital, Singapore. His special interest is in gastrointestinal cancers. Hello, Dr. Phu. Welcome to my show.
Hello, thank you for having me.
Yeah, it's a pleasure. So viewers, will be starting our show firstly with Dr. Phu. We'll be trying to know about gastrointestinal cancers at the from the first part of on the show. So Dr. Phu, I'll be as you are dealing with malignancy or cancer patients for a quite long period of time, what sort of gastrointestinal cancer you encounter from this part of the world frequently?
So I do see patients with colon cancer, stomach cancers, liver and pancreas cancers. These are the most common gastrointestinal cancers from this part of the world.
I see. So do you have any data like how frequent it is, particularly like colon cancer overall globally? What is the incidence or prevalence of colon cancer?
Okay, you asked me a question which I can't quite remember, but I think overall colon cancer is either second or third in terms of frequency. But in Singapore, it's the most common cancer in the whole population. Yes.
Okay. Yeah. So can you brief me about the common symptoms of colon cancer and other GI-related cancer?
Okay. So for colon cancer, being the most common, is more common in men compared to women, and also the main symptoms that patients do have is commonly they get a change in bowel habit. For example, you go to the toilet every day, so some people, they find that they are constipated, or they have alternating constipation with diarrhea, and often they do get bleeding when they pass motion, as well as bloating of the stomach. They get a lot of tummy discomfort, and then of course when it's more advanced, they do get loss of weight, loss of appetite. And also some patients, they do present with, because of occult bleeding, they lose blood, so they don't have enough blood. So signs of anemia, where they have breathlessness on exertion, sometimes even going to cardiac failure if the anemia is very bad.
Okay. Yeah. So some tummy related issue. Do you think it can happen with other common conditions apart from cancer?
Yes, we do have this problem because there's a condition called irritable bowel syndrome, which has quite common symptoms like cancer, but we do differentiate by what, as I was mentioning, like pain. People with IBS normally don't get pain at night. They usually don't have loss of weight or loss of appetite. So when you have pain at night, when you have loss of appetite or weight, it's time to see a doctor to make sure that there's no cancer.
Okay, so when the patients who is having some bowel issues, losing weight, and the symptoms when occurring at night,
yes,
you must be visiting a doctor.
Correct.
At the earliest time. So I'll be coming to Dr. Chan about some liver issues. I would like to know what are the common causes of liver failure?
So liver failure, broadly we can divide them into acute liver failure and chronic liver failure, or chronic liver disease leading to liver failure.
I see.
So acute liver failure, there's a multitude of causes like viruses, drugs, some metabolic causes. Chronic liver disease, usually they are broadly again due to viruses, and these are liver-specific viruses, so they stay in the liver for a long time and they cause long-term damage. It can also be caused by people drinking alcohol, but sometimes it may be what we call idiopathic, means the cause of the chronic liver disease is not known.
Do you think fatty liver can be a cause behind advanced liver disease or cirrhosis of liver?
Yes, definitely. So fatty liver is very prevalent now, and it can start with inflammation. The inflammation will lead to repeated cycles of healing and more inflammation, and this causes laying down of fibers, what we call fibrosis, and that cumulatively can lead to hardening of liver, otherwise known as cirrhosis. The cirrhosis itself can, if it's severe, it will become a cause of liver failure.
Okay.
Yeah.
So basically, at what point of time you offer a person for liver transplantation? We see people with chronic liver disease roaming around, getting some treatment, drugs, and they're visiting doctors. At what point you offer liver transplantation?
So chronic liver disease, again, we can divide them into compensated liver disease and decompensated liver disease. Compensated liver disease essentially means that a patient might feel okay, they are going about their livelihood without very much symptoms. But once they become decompensated, the liver is not functioning well, they may accumulate fluid in the body, they cannot process the bilirubin, and the skin, the eyes might turn yellow. And these are indications that the liver is not doing well, and liver transplant should be considered.
Should be considered.
Yeah.
So about the process of liver transplant, living donor liver transplant and deceased donor, which one you prefer in your center?
These are the two options, and whether which option is preferred, it really depends on the country, the availability of organs. For deceased donor organ transplantation, obviously, it comes from a person who's brain dead, and many of these, whether it's available for donation, depends on cultural factors, religious factors, and even legislation. And because of that, there may be an organ shortage if we just depend on deceased donor alone, and that's where the living donor comes about. If you ask me between the two, which do I prefer? I would prefer deceased donor, because for a living donor, you're actually putting a healthy person at risk of the surgery.
Okay.
Yeah.
What is about the risk for the donor? In a situation when deceased donor is not available, so we have to get the liver from a living donor. What about the risk for the donor?
So the living donor surgery is a major surgery. It is a very safe surgery, but because it's a major surgery and the liver is a very vital organ, there's a chance for major complications and even death. The risk of a major complication is between 5 to 10%, but the incidence of death is very low. It's less than 0.1%. So overall, even though I say that it is a risk to the patient, to the donor, it is a very safe surgery generally. Yeah.
Okay. I'll be again coming to you with some liver transplant surgery related issues. To Dr. Fu, I would like to know about the diagnostic modalities. So how do you diagnose colon cancer?
Okay, so generally when a person has symptoms, the first thing they have to see a doctor. If the doctor suspects that he has cancer, usually they will refer for what we call a colonoscope, where they put a tube into the anus, which is like a telescope, into the intestine to see. And if there's something abnormal, they will biopsy to confirm. And then once it's confirmed, we want to stage the cancer. So normally we either do a CT scan, certain parts like the rectum, we do an MRI, and of course people who can afford it, maybe a PET scan to see whether there's any spread anywhere. And then based on the staging, we'll decide which stage and what is the best appropriate treatment. Most of the time for stage 1 to 3, the first treatment modality of choice is surgery. For stage 4, there is mainly chemo, but sometimes if the intestine is quite blocked or in the danger of completely blocked or bleeding, then we'll send them for surgery first before they go on to receive chemotherapy.
I see. So any recent advancement in the diagnostic process, like in the camera test or any other diagnostic modalities, any advancement?
Not really, not for colon. But for stomach, I think in Singapore we are doing this blood test, which they test different genes to see if a person who is high risk, person with family history, and whether they have all those genes and the likelihood of having a stomach cancer, and then they will be followed up more closely or go on
they will
for
be under
scope.
surveillance.
Yes.
So there are some genetic testing you offer for screening purpose in susceptible individuals, particularly for stomach cancers. We'll get to know more about gastrointestinal malignancy and liver issues. We'll be getting more information from you just after a short break. Hello viewers, welcome back to Doctor's Voice. Today we are discussing about gastrointestinal malignancy or cancers and liver surgeries and liver transplant related issues. We have Dr. Chan on my right side. He's a general surgeon with special interest in hepatobiliary pancreatic surgery and liver transplant. And Dr. Fu Kian Fong on my left side. He's a medical oncologist practicing in Mount Elizabeth Hospital and Gleneagles Hospital, and his special interest is in gastrointestinal cancers. Viewers, let's get back to the discussion. So just before the break, I was asking you about the recent advancement about the diagnostic procedures. You were saying that some gene issues can be done for stomach cancers, and which helps us to keep some persons on surveillance. So about the therapeutic or treatment related issues, you were saying the mainstay of treatment is surgery in most of the cases.
Yes.
And you can offer chemotherapy at the same time. So any advancement in or any other options you can offer to your patient? Okay,
so in general, for stage 2 and 3 cancers, after surgery, selected patients for stage 2, but practically all stage 3 patients, we do offer chemotherapy. And that is what we call adjuvant, that means post-operation, to improve the chance of curing them. In stage 4, the treatment is still mainly chemo. Over the last 10 years, of course, we have targeted therapies. We've got, over the last recently 5-6 years, immunotherapy. But I must stress that immunotherapy is very limited to about maybe 3 to 5% of all the colon cancer patients, because we need to do a special gene test called an MMR test, and to see whether they are suitable. As I said, out of 100, maybe 3 to 5 may have the suitable genes, and these people will respond very well to immunotherapy. Okay. Yeah. I'll be again coming to you with the cancer issues. At this moment, I would like to know from Dr. Chan, you were saying that living donor liver transplant is a process which can be done safely in most of the cases. More than 90 to 95% donors are in the safe side. They don't have any extra risk. So how do you prepare for transplantation in such group of patients?
So the donor surgery, before the donor surgery is done, the donor will undergo a very complete evaluation by various specialties or specialists, such as the cardiologist, to make sure that the heart is functioning well to undergo the surgery, as well as review by the medical social worker. And that's very important because we have to understand the motivation for donation, and the motivation is out of altruism, out of love for the person that he or she is donating to. So there's also a psychological assessment by the psychologist and the psychiatrist. Beyond that, the surgeon's role before the surgery itself is to determine if the liver, the donor's liver, is suitable for donation. And what I mean by suitable is we need to look at the size. The size of the liver has to be sufficient such that the liver graft or part of the liver that's given to the recipient is of adequate size. And yet at the same time, there must be enough liver that's left for the donor for safe functioning. We also look at the anatomy, the structure of the blood vessels, the bile ducts, to make sure that it's again suitable and a safe surgery can be conducted.
Okay. Yeah. So, in most of the cases, tummy surgeries can be done nowadays by laparoscopically or keyhole surgery. In such cases, liver transplant surgery and donor surgeries, how do you do that? Is it open, or you can do offer laparoscopic procedures?
In Singapore now, we do many of these surgeries in a laparoscopic fashion, meaning that the donor surgery on the liver is done in a laparoscopic keyhole fashion. And in order to do that, the surgeon has to be experienced in both keyhole surgery or laparoscopic surgery as well as liver transplant.
Transplant surgery. Yes. He needs a special skill. So about the length of a hospital stay and post-transplant care, I would like to know. And what are the reasons behind transplant failure?
Yeah, so for the donor surgery, the advantage of a laparoscopic or keyhole surgery is such that the pain is a lot less, the cosmesis is a lot better because they're all small little scars, and the stay in hospital is shorter. So many of our patients or many of our donors go home after 3 days or 4 days. They'll be followed up closely by regular blood tests as well as ultrasound. But in general, once they have recovered from the hospitalization, most patients shouldn't have any issues. Yeah.
I see. Thank you. I'll be again coming back to you at the last hour of the program. Dr. Fu, I would like to know about the screening process, as colon cancer is one of the leading cancer globally, and you were saying that it is the leading most common cancer in Singapore.
Yes.
In this part of the world, I think it should be in the top 3.
Yes.
So how do you screen? How do you offer screening?
Okay, so the guidelines currently is at the age of 50. Both men and women should undergo what we call a screening colonoscopy. That means even if they have no symptoms, they should go for it. The other test that they can do is a yearly fecal occult blood test to see, of course, if it's positive, they have to go on to do a colonoscopy. Our problem in Singapore is about 68% of our population above 50. They did a study and they found that all of them refused to do it because they say, I don't have any symptoms, why must I subject myself to all this? But they do not realize the benefit of the screening. Although, of course, there's a recent study that came out from Europe that seems to suggest otherwise, but I think there are some flaws in that study, so people have criticized part of the studies, but we still stick with the idea.
Guideline is
we still
offer,
do the offer, yes.
Colonoscopy. So apart from colonoscopy and fecal stool blood test,
yes,
any other advanced test on the pipeline to offer? As you know, the camera test is an invasive test and people don't feel comfortable to go for it.
Yes, so I think there's another study coming out from Singapore. They are looking at genes again, like what they did it for stomach, but it's still, we are waiting for prime time. Yeah, it's still in research.
Okay. So I would like to know about the prevention and about the lifestyle and diet issues. How can we get rid of and we can stay away from colon cancer and GI cancers?
Well, so the usual, like what your mother say, eat your vegetables, all right, have a more plant-based diet, cut down on the red meat, and then cut down all the deep fried barbecued stuff. Not that you don't eat, but cut down. Do your exercise. We recommend at least for people who are above 50, a brisk walk, or if they can jog, it'd be even better. At least 150 minutes of moderate exercise per week.
Yeah. Okay. Many thanks for your advices. Dr. Chan, I would like to know from you that after liver transplantation, what are the reasons behind failure?
The failure in the recipient.
In the recipient.
Yeah, so the liver transplant is a new lease of life for the recipient. You know, the recipient whose quality of life is so bad and suffering, and with the new liver, it's a new lease of life. However, as you said, it's still at risk for subsequent failure, and oftentimes this risk goes back to the reason why they get the liver failure or the liver disease in the first place. So if it was a virus that causes it, then there'll be medication to prevent this virus from recurring in the new liver. If it's a fatty liver leading to the liver disease, then you definitely need to change the lifestyle, change the diet. Because the new liver itself, even though it's a healthy liver, can still become fatty if none of those changes are undertaken. So it is an important thing to look after the new liver.
Okay, so even after transplantation, we have to take care of the liver very much. So we are at the end of our show. Lastly, do you have any message for our viewers in a very briefly?
I think most important, lead a healthy lifestyle and go see your doctor if you're not well, and engage in screening if you are above 50 years of age.
Thank you. Dr. Chang?
I think that the living donor, living transplant is definitely an option that is to be considered for countries or for places whereby the cadaveric donor is not cadaveric organ is not available. And the donation process, the donor surgery is actually a very safe surgery, and it's a new lease of life, as I said, to the recipient. who's receiving this gift from the donor.
Thank you to both of you for giving your valuable time to us. I wish you have a safe journey back to your home. Dear viewers, today we got to know about gastrointestinal cancer and liver transplantation. For gastrointestinal cancer issues, I would like to request all of you, those who have crossed the age of 50, as per international established guideline protocol, the screening process is to undergo colonoscopy, that is a camera test, to screen out for colon cancer, so that we can stay away from colon cancer. And liver transplant issue, dear viewers, liver transplantation is a sophisticated process in a good center under a skilled hand. It can be a safe journey for you, and it can give a hope of new life to you. Thank you for your patient hearing. On the next episode, we will be listening to another new topic. Till then, stay fine, stay tuned. Thank you.